Let's learn what robotic laser technology is and how it works. Now let's move on to the latest technology treatments. Since we have hernias, hernia is a tough disease. Since it's a sneaky disease and our nightmare, you no longer hear treatment. No losing hope, no fear, no suffering through this for years. Doctor, I've been suffering from a herniated disc for 30 years. You've lost 30 years, you've lost 30 years. The longer a person lives, the more comfortable and healthy he or she lives, the better his or her life will be. That's why you are no longer hopeless. Please don't be fearless, don't be afraid. And lower back pain, herniated discs, cervical discs are diseases that we can treat very comfortably, very easily. Why? Because our technology has understood it well.
So robotic laser.
Before this, lasers were used in industrial tech, military tech. They have been in healthcare for 20 years.
It has been used in many places. It's been 20 years in healthcare.
Look, it has been used in healthcare for 20 years. For the last years, we have been gaining experience. So it is experiencing what kind of effects lasers have on the spine, hernias and joints. Now, robotic laser technology is at a very advanced level. Because in earlier times, in primitive times, when these technologies first emerged, the issues we call herniated discs in the lower back and cervical region occurred deep within the body. So these issues might be about 10 centimeters deep. Therefore, for this technology to reach that point and target it, while also being able to do this without damaging important tissues around it, and for us to be able to effectively demonstrate all of this, it takes time. And now, we can use these technologies very comfortably. It can do this without damaging important tissues. And it takes us 6 months to be able to demonstrate all of this effectively. And now we can use these technologies very comfortably. We have built our experience from thousands of cases. And now if you had asked me 5 to 10 years ago whether robotic laser could treat hernias, I would have been uncertain. As a brain surgeon, I would say let's not make fun of the surgical mindset. And there are still those who say that. There has always been a struggle between traditionalists and innovators in the world. Many people prefer the classic.
We are innovators.
Therefore, is a technology is extremely effective. I always say that it's the last exit. For the bridge, enough to save us from surgeries, for our hernias. Because it didn't go away with medication treatments. We did physical therapies, but it didn't go away. We had a situation in front of us that looked like surgery. But now, before surgery, and even after physical therapies, there is a huge technology in between, and treatment methods have developed. So now, we can easily relieve patients from hernias that we used to have to operate on with tiny methods or technologies like robotic lasers, and treatment methods have developed. So now, we can easily relieve patients from hernias that we used to have to operate on with tiny methods or technologies like robotic lasers. Are there any cutting, shaping, or needle procedures in robotic laser treatment?
Absolutely.
So how do you get into an MRI? You all know. You've all been in an MRI. How do you get into an MRI? It's a device. Of course, we manage that device with our experience. Which hernia requires what kind of approach? There are many protocols. What those protocols should be is important. Just having the device isn't enough. The experience to use the device is also crucial. In all, hernias. Don't think there are many people in the world, especially with the robotic laser device, who have my level of experience. I have over 15,000 cases, which is a huge number.
Over 15,000 cases.
Therefore, as a result of this vast experience, we teach the device what kind of applications should be done for each case and how it should navigate. The device performs these applications. A needle doesn't even penetrate your skin in this sense. These are 15 to 20-minute procedures. Not even a needle goes into your skin in this sense. These are 15-20-minute procedures. By evaluating all of these factors one by one, the degree of the hernia, its level, the patient's age, type, style, and strength, we tell them what and how we need to do things. Sometimes, of course, hernias can be very old. Can I explain a hernia at the age of 30?
They spent a long time together.
It's been there, it's settled in, it's taken over that area, you know?
I mean, for 30 years.
We need to soften those hardened hernias in a way. When they first start to form, hernias are like soft candy. They're very soft.
These are the easy times. What do I say for that? Don't be late.
If we catch hernias early, especially within the first 3 years, we can definitely remove them from the root.
Clear.
But as it progresses, it starts to become like a Mevlana candy.
It's going towards calcification.
It's getting crunchy. Can I explain?
Yes.
After a while, after about 5-10 years, it becomes like a roasted chickpea candy. I am from Kütahya Tavşanlı. Our roasted chickpeas, I mean, no offense to the people from Sorum, are better, you know. I can say it's better than Sorum. There are these crunchy roasted chickpeas.
That's it happens with hernia.